afternoon everybody. I am Dr. HEBSIBA HELSIE, Department of Biochemistry. Today we are going to see about anemia and its types. In this, we are going to see about the definition of anemia, classification of anemia, and what are the causes of anemia, symptoms of anemia, and how we are going to investigate this anemia in the clinical laboratory, and what are all the treatment available and how to prevent the anemia in detail. So first we have to know about what is anemia. Anemia is An is without, anemia is blood. So without blood, it is a decrease in RBC count, hemoglobin and our hematocrit values result in the lower ability for the blood to carry oxygen to the tissues. So this is the definition of anemia. Coming to the pathophysiology, it is a decrease in RBC cells or hemoglobin or hematocrit level. So while hemoglobin level is decreased, oxygen carrying capacity will be diminished, resulting in the hypoxia. Hypoxia is nothing but the deficiency of oxygen. So if the oxygen is deficient, automatically the organ functions will be affected, and it leads to the signs and symptoms of anemia. And coming to the normal values of hemoglobin, for men it is more than 13 grams per dl, for women is more than 12 grams per dl. dl is deciliter of blood, and for pregnant women is 11 grams per dl, and for infants to 2 to 6 months it is more than 9.5 grams per dl. For children from 6 months to 24 months it is more than 10.5 grams per dl. For 2 years to 11 years it is 11.5 grams per dl, and for children it is 12 years. From 12 years it is more than 12 grams per dl. Then coming to the classification of anemia, we can classify anemia on the two categories. One is on the basis of cause and another one is on the basis of morphology. On the basis of cause, it is again subdivided in, due to blood loss, inadequate production of normal blood and excessive destruction of blood cells. And on the basis of the morphology, it is classified as normocytic anemia, microcytic anemia and macrocytic anemia. So we can see those type of anemias in detail. So based upon the clinical pictures, it is again classified as iron deficiency anemia, megaloblastic anemias, pernicious anemia, hemorrhagic anemia, and hemolytic anemia is divided into two classes. One is thalassemia anemia and sickle cell anemia, and the last one is aplastic anemia. Hemorrhagic anemia is the excessive loss of RBCs through the bleeding. Okay, so bleeding of stomach or bleeding stomach ulcers or due to the menstrual cycle. So due to menstrual cycle, the excess of bleeding will be there. So there will be loss of hemoglobin leads to hemorrhagic anemia. And this hemolytic anemia, hemo is blood, lytic is breakdown of cells. So breakdown of blood cells lead to anemia. So this RBC plasma membrane ruptures lead to the hemolysis of blood cells, leads to hemolytic anemia. Next, thalassemia. Thalassemia is one type of anemia. So this is the less synthesis of hemoglobin. So hemoglobin, if it is synthesized in our body in the low amount, it leads to thalassemia. So this thalassemia is found only in a particular type of population, especially in the Mediterranean Sea. And next one is sickle cell anemia. In sickle cell anemia, it is a hereditary disorder. It is a genetic disorder actually. Here, the characterization of blood cells is abnormal. Usually, the RBC is capable of carrying 4 oxygen molecules, but in the sickle cell anemia, that biconcave shape of the RBCs with sickle, it leads to the boat shaped of the RBCs leads to sickle cell anemia. The next one is aplastic anemia. This is due to the destruction of bone marrow. So in the bone marrow only the red blood cells are biosynthesized. Due to the destruction of bone marrow, the biosynthesis of hemoglobin is restricted and it leads to the aplastic anemia. And this aplastic anemia is also due to the toxins or due to some gamma radiations. And based upon the cellular capacity of the cells, it is anemia is classified as normochromic anemia, normocytic anemia. So here the normochromic is nothing but the normo is normal type of cells, chromic is the shape of the cell, so it is being defected, so it leads to the anemia of chronic diseases and hemolytic anemias, anemia of acute hemorrhages, aplastic anemias. So this is normochromic and normocytic anemia. Hypochromic and microcytic anemia. Hypo is less, so less chromic, less color RBCs. Micro is very diminished. Cell size will be very low. So this is hypochromic microcytic anemia. Cytic is cell. So this includes iron deficiency anemia. If the low content of iron is intake in the food, it leads to iron deficiency anemia. So thalassemia, we have already seen about thalassemia, and anemia of chronic disease. Chronic disease in the sense, if the body is conditioned to other diseases like cancer and all, it leads to anemia. So normocytic macrocytic anemia, it includes vitamin B12 deficiency and folate deficiency. So if the anemia should be prevented, we have to take sufficient amount of vitamins in our diet. So the requirement of iron is given in this chart. So we have the increased requirement of iron for the menstruating females, because during menstrual periods the blood will be lost, so we have to take high amount of irons. And for the pregnancy, because the child and the mother should take the sufficient amount of iron for the normal growth of the child. And lactation is nothing but nursing the child. So this lactation woman has to take the increased amount of iron, and growing infants and children, and erythropoietin treatment. Erythropoietin in the sense biosynthesis of the RBCs. And increased blood loss will be due to bleeding, GI bleeding. GI is gastrointestinal tract, right from our mouth to the anus, and menorrhagia, persistent hematuria. Hematuria is a loss of blood in the urine, and intravascular hemolytic anemias, and regular blood donors, parasitic infections. So these leads to the decreased loss, and decreased intake of vegetarian diet. Okay, so low intake of vegetarian diet also leads to anemia. And decreased absorption is upper GI pathology. And gasectomy is nothing but the removal of the small part of the intestine is gasectomy. And medicines, that is usage of antacids or Zantac, leads to anemia. And these are the common symptoms of anemia. So easy fatigue and loss of energy. The people suffering from this anemia will be very tired, usually see, and they will be suffering from loss of energy, and usually rapid heartbeat will be noticed. So while they walk, or while they climbing the steps, or while they are doing exercise, they will experience this rapid heartbeat, and shortness of breath, headache, frequent headache for no reason, and particularly during exercise, and difficulty in concentration, dizziness, pale skin, leg cramps, insomnia. Insomnia is nothing but difficulty in sleeping. So anemia is caused by the iron deficiency. So some people with iron deficiency may experience this type of symptoms, that is hunger for strange substance. You may notice some people will eat some papers or ice or some dirt. So these type of strange hungers also the symptoms of the iron deficiency anemia. And upward curvature of the nails referred as the kynochisis. Upward curvature of the nails in the sense the nails will be look differently, and soreness of the mouth and cracks of the corner. And anemia is caused by vitamin 12 deficiency. Here there is a relationship between vitamin B12 and the anemia. If the vitamin B12 is adequate in our food only, the absorption iron will be enhanced. So this vitamin B12 deficiency leads to iron deficiency anemia. The main symptom of this is loss of sense to touch. So if we touch a person, they will not sense that we are touching those persons. So that is the main symptoms for them. And wobbly gait and difficult walking. So while they are walking, we can notice they feel some unusual type of walking will be there, and clumsiness and stiffness of arms and legs. Dementia is memory loss. So they will not remember certain things, and hallucination, paranoia, and syncophrenia. So you know about hallucination, that is they will assume that some strange things happen around them. So that is known as hallucination. So these are the main causes of anemia caused by vitamin B12 deficiency. And major noticeable change symptoms of anemia is brittle nails. Brittle nails in the sense the nails will be easily broken down, and spoon-shaped nails will be seen, and atrophy of the papilla of the tongue, that is tongue, the color of the tongue will be different, and angular stomatitis and brittle hair, and dysphagia and glottis, plumber or vision. So these are the main symptoms of anemias. So here there is a pictorial representation of this, how severe the anemia will be. In the eyes it will be yellowing in color, the skin will be pale, coldness and yellowing. In the respiratory system, the shortness of breath, so there is insufficiency of oxygen which is carried to the lungs, muscular weakness, intestinal changed stools. The color of the stool will be different. Usually it will be yellow color, but it will pale color stools will be noticed. And central, the brain system will be affected. So fatigue, dizziness, fainting. The people will walk and suddenly they will faint on the road or in the house. So these type of symptoms will be noticed. And blood vessels, low blood pressure will be noticed. Heart will experience a palpitation. Palpitation in the sense a higher heartbeat or lower heartbeat, and chest pain, angina. Angina is the chest pain. Heart attacks will be noticed, and spleen will be enlarged, which is known as splenomegaly. And coming to the investigations, there are many lab investigation, clinical biochemical laboratories are available here. So quantitatively parameters we have to see about the packed cell volume, hemoglobin concentration, red cell concentration per unit volume, and for qualitative parameters, mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration will be noticed. So for men, for hematocrit is 4 to 52%, and women 36 to 48%. For cell volume hemoglobin, for women 12 to 16 grams per dl, and men 14 to 17 grams per dl. Red cell count, men 4.2 to 5.4, 10 to the power of 6 per millicubes, and for women it is 3.6 to 5, 10 to the power of 6 mm cube is the thing. And so coming to the treatment, so we can give 12.5 milligrams of iron, that is 50 Ug of folic acid per day, and normal for the normal and low birth weight for duration for 6 to 24 months of age and 2 to 24 months of age. And for severe anemia, for age group less than 12, we can give this iron tablets along with the folic acid daily for 3 months. For 2 to 12 years, 60 milligrams iron along with 400 Ug of folic acid per day for 3 months. For adolescents, it is 120 milligrams per 400 Ug folic acid daily for 3 months. So these are all the symptoms, classification, treatment and prevention of anemia. So I hope you can understand this. Thank you.